Scott, I was a pastor for 10 years, and one of the things I did more than anything as a pastor was spend time with families at the hospital when someone was sick and a lot of times dying. I think I probably did 50 funerals in about 8 years. And a lot of those people's death came very slowly, very painfully, a lot of them with cancer, and they'd have all kinds of treatments that they would have to go through, and inevitably the time would come in that family and that person's life where they had to make a very tough decision. And the decision was, do we continue on this path of treatment, or do we continue on the path of keeping someone alive on a machine or something like that when it begins to look like there's just no hope that this person's ever really going to live again? And they have to make that call, and it's very painful. It hurts. They question the morality of it all the way through. And so I know you've done a lot of work on this and thought about this a lot. So let me just ask you the question, is that okay? Is it okay for a family to turn the machines off or to stop the treatments?
Under the right conditions, yes, it is. It is okay to say enough to medicine. We are not under any obligation to keep people alive at all times and all costs. The Bible's really clear about this, it seems to me, that for one, death and dying were not a part of God's original design. Death came as the result of the entrance of sin. And yet, the wisdom literature also tells us that death and dying are a normal, natural part of life. Not because death is morally neutral, as the culture insists, but because of the pervasiveness and universality of sin, death is a normal, natural part of life. The gospel tells us the really good news that that's not the end of the story, that death is also a conquered enemy. And because of that, it need not always be resisted. And under the right circumstances, it is morally acceptable to allow the dying process to take its natural course. And in doing so, it seems to me we are turning that person back over to God. And if it all goes like it should, families actually have the privilege of helping usher that person right up to the doorstep of eternity. It's a sacred moment.
So you mentioned if it's done in the right circumstances. So now let me ask you the question, well, how do we know when we are in the right circumstances? What are some principles or some guidelines there?
Well, let's say, God forbid, if I had a heart attack right now, you would treat me. You wouldn't say stop to medicine on that.
Right.
And the reason is because, one, I'd want you to treat me. The second is because my prognosis is very good. My chances of recovery back to a normal life are outstanding because I'm in just robustly great health at the moment. And so think about that in reverse then. What I think the conditions under which this is acceptable, one is if an adult who's with the program says to stop, under the law you have to stop. But most of the time they say that if their prognosis is very, very poor, and if further treatment is either futile, which means it's not going to stop this sort of irreversible downward spiral toward death, or more commonly, if the treatment is more burdensome than beneficial to the patient. Because most treatments have some maybe marginal benefit, but these treatments are really costly to the patient's health and well-being, not to mention financially too, though that's not a consideration at this point.
So then, if we do that though, I think a natural question that people want to know, and we'll push back on that a little bit, is well, but isn't this still just at the end of the day euthanasia? You're signing off, so to speak, on their death, and if we do that, if that's right, if that's the right feeling, maybe it's not, but if it is, can we really still hold such a high view of life that it's sacred?
Yeah, I don't, although it may feel like you are killing your loved one, I don't think that's true, because the cause of death is not your decision or your intervention. The cause of death is the underlying disease that we are allowing to take its natural course. If it were killing, direct killing like euthanasia would be, and that would be if I gave you a lethal injection that stopped your heart. Right? That would be euthanasia. That would violate the sanctity of life. But the sanctity of life does not obligate us to keep everyone alive at all costs and all times. And the reason for that is because earthly life theologically is not the highest good. Our highest good is our eternal fellowship with God. Earthly life is what we call a penultimate good. It's important, but it's not at the top of the pile.